So the Biden administration has finalized its rule regarding short-term health plans. Here's what you need to know. First, what does this new rule apply to? It applies to short-term limited duration insurance, or also known as STLDI, or short-term insurance. Short-term insurance was designed to be temporary coverage for those who are kind of between two plans and knew that they were going to get coverage again soon, but weren't sure yet where that coverage was going to come from. So they got a short-term plan. They were meant to be under a year, so less than 12 months, and they couldn't be bought in the marketplace, and they weren't associated with the Affordable Care Act. They were purchased off of that platform completely. They could be renewed a couple of times. Someone could have a short-term plan for as long as 36 months. Sounds good so far, right? Some people who don't have access to other plans might want something for a short duration of time. But some advocates have taken to calling these plans junk insurance. This is because they're not available on the marketplace, and so they're not adhering to the same rules that those plans that are sold on the marketplace are. This, on the positive end of things, gives a cheaper premium opportunity, but it is usually unclear how many holes are actually in this coverage. So many of these plans don't offer every one of the 10 essential health benefits, and they don't cover pre-existing conditions a lot of the times. Both of those are required on the marketplace. So people sometimes assume that this coverage will come with these things because they hear about how they're required by law, but they're only required by law by plans that are sold on the marketplace. So those plans that they see aren't coming with those things, and they get surprised when they go to the doctor or when they end up in the emergency room or something like that with a huge bill. Once this rule goes into effect, short-term healthcare plans will only be allowed to be signed up for 3 months with 1 month of extension, so a grand total of 4 months. Consumers are not going to be able to daisy chain them together anymore and get coverage for years that was only meant to be a duration of less than a year. So theoretically, the 1 to 3 million people who are on these plans right now might not be able to continue to use those types of plans. And theoretically, we should see a drop in the use of these plans, right? But that's not to say that these plans are going to go completely away, because there might be still some people who use them for short stints for what they're designed for things like time between jobs, or maybe some time in grad school, or maybe between Medicare and retiring, right? Those who currently have this type of coverage aren't going to just see it drop off after 3 months. If they have a contract that goes through a certain time longer than 3 months, they still will keep the contract that they're currently in, but they will not be able to renew that contract again after that. So what does this mean for you as a health insurance agent? So it means that just like during the unwinding, which we still are in to this, basically to the end, we're in the end of it, there will be a new group of people who will now have a need for coverage that didn't need coverage before, right? And these people probably don't have access to things like Medicaid or group coverage, or else they already would have gotten that coverage. So you as an agent should be getting out there and advertising yourself more than ever as an under 65 agent. Get yourself registered to the marketplace for the Find Local help, so you can be the person that they go to, even if they don't know who you are quite yet. Or, well, both really. You also should be advertising yourself with marketing materials, either online with your carrier or in your office with printouts, or using some of the marketing materials that we have created for you here at Action Benefits. Contact us for some of that marketing material, or go on any of our social media pages, or go to our website to get appointed with any new carriers so you can get out there and start selling to these people who now will need some additional avenues for their coverage.